I think before we end, there's a couple things, but one is I wanted to make sure we had plenty of time for questions at this point. Anything about ALS, clinical care of ALS, research, anything that Dr. Swerdlow or Dr. Weir talked about, we'd be glad to answer those. Or if you don't want to ask them right now in front of the group, Dr. McVey and I can stick around for a few minutes afterwards to do that. Any questions that come up from patients or family? Or yes?
I read an article in the New York Times last year talking about research that was being done that Lou Gehrig may not have had ALS.
Yeah.
And basically a study saying a lot of athletes or anyone that experienced a lot of concussions, such as soldiers, it's a disease very similar but not the same.
So I'm very aware of that, and it came out of Boston University, and I think it's a semantics word game, but they got a lot of press out of it. And and we wrote a letter to the editor, our group did, folks in our Western ALS study group, because what they were, to sort of, not to argue with them a little bit about what they were saying, because Lou Gehrig did have ALS. He was an athlete. Maybe he had some head trauma over the course of his years. But what they were finding was that, I guess they were finding some ALS patients who had had head trauma as well, and the patients had died, and they were looking at autopsy material, and they saw some changes in the brain that they thought were consistent with, a head trauma syndrome, and so they were trying to say, well, if you have head trauma, then, and if you get weakness, then what was the term they were using, Russ? It was brain trauma motor neuron syndrome or something like that. They made up a word. But I actually think it's all just it's all just ALS. And so there is, however, there may be some truth to the fact that athletes or people that have head trauma or certain types of stressors like that in their life might be more predisposed to developing true ALS. I mean, and I think that's what they probably were saying, but they couched it in the fact that they were describing a new disease. And I don't think they were. But so the question is, do athletes and veterans who have had head trauma, are they more predisposed to getting ALS? And the initial epidemiologic information seems to say that may be true. So we're involved now in a trial that Dr. McVey alluded to called Oxidative Stress in ALS. And it's funded by the NIH, your tax dollars, and the principal investigator is Dr. Matsumoto at Columbia. And we're a site in that trial. And so all new patients with ALS are asked to be part of that trial. Maureen talks to them about it. So what it involves is giving a blood specimen, a urine specimen, a skin biopsy, and then at some point getting on the telephone with these questionnaires from New York, and they ask an hour or two of questions about things like head trauma, sports injuries, and also dietary questions and any toxic exposures. And so the idea is if they can get this information on several thousand patients and then put it in a database, maybe we can sort out more rationally, is there an increased incidence of these sort of events in patients with ALS? Just from the clinic standpoint, anecdotally, it seems like there is. So that's what that big press thing was out of BU last year. But I don't think that most of us in the ALS field really have bought the idea that Lou Gehrig didn't really have ALS. But I think there probably is an association there. Yeah, Becky? You know, there is a bill was passed by Congress, I guess, and I don't know a whole lot about this. I've sat in the meetings, but I still don't understand it. To allow for an ALS national registry, and so there's a whole governmental agency that's involved in this, and that could be the problem because I've sat in the room with the people who are in this agency, and they can't explain it to the ALS physicians on the front line, like me in April, to say what it is they're going to be doing. And so it's in the early phases, but it's probably a good thing that Congress passed this law to create an ALS registry. But right now, exactly what's going to be in that registry and how it's going to be reported is being worked out. And so I know we had a meeting in Orlando with the government folks that are putting this together, and I guess there'll be another one either in Hawaii when we go there or in New York at the meeting in the fall. So it's a good thing. We have not incorporated that into our clinic because the way I understand it, the physicians are not going to be putting in the data. It's the patients are self-reporting the data, which could be part of the problem. I mean, I think when you have patient-reported data, it's not as well controlled. And like what Dr. Mitsumoto is doing with his oxidative stress study, they go to the patient, they get the data, and then they put it all in a database. And so it's all sort of, the scientific parameters, they're all there. And if it's self-reported, I think there could be too many loose ends. But it's better than nothing. It's better than nothing to have some sort of registry. So I think it's still in the early phases, and they're trying to figure out how to implement it and how the physicians are going to use it. Any other questions? So, Susan, you said we have a couple things here.
And also,
we had a door prize, apparently. I wish it was the cure to ALS, but it's probably not.
There's a name, Carol.
Where's our name?
Here.
The Pollocks, Tom Pollock. Where's Tom Pollock? There you go, sir.
Oh.
You win the... And a member of our healthcare team, Dave Burkett. You win the door prize.
Also, there's an evaluation form if you'll take a few moments
All right.
and get that completed for me and just leave it on the table. I would greatly appreciate it.
All right. Well, thank you all very much for coming. I'm glad there's such a nice turnout, and we'll do this again next year. And thank the faculty and the healthcare team for coming, too. Thanks.